All right, good morning, Queensland. Well, in some excellent news today, we have 0 new cases. So that's 0 in the community, 0 in hotel quarantine. So that's wonderful news. And I want to thank Queenslanders for that mighty effort. And of course, we don't know what's going to happen in the future. So we always need to make sure that we're keeping our guard up. And if you are sick, please go and get tested. It's absolutely critical that people do that. We now have 129 active cases. We still have 3,325 people in home quarantine, and I thank everybody for doing that. We've done 9,209 tests in the past 24 hours. Queensland Health did 6,724 vaccines in the past 24 hours. And at the Brisbane Convention and Entertainment Centre on Sunday, 3,080 vaccines were done. So well done, and thank you to all the staff out there and for everyone who came along and got their vaccine. So today, in more good news, Ironside State School will be open, and of course we thank the Commonwealth for getting some of that extra vaccine doses at Pfizer, so we'll be getting 136,890. And what we want to do there is we want to expand the capacity at Logan and also at Caboolture. So across that southeast, we want to make sure that our vaccination levels are roughly equal across the southeast. We are seeing some lower take-up rates in those communities, and I want to make sure that we get some of the extra vaccine out to those communities. So over the next couple of days, we'll be ramping up the capacity there, and the Health Minister will be able to brief you on that. Now, can I just say to everyone about the border? Can I thank people for their patience? We did see some delays this morning, as we expected. Since 9 o'clock, those delays have come right back down, with the M1 being about an hour and the Gold Coast Highway about 28 minutes. New South Wales is currently in lockdown. There are stay-at-home provisions, so the movement needs to be minimal. And of course, we only have those exemptions for those essential workers. We also know that the positive sewage testing for Delta has been creeping northwards, so we are very concerned. Police and our officials are stopping everyone coming in from the southern states into Queensland through our airports, and they'll be stopping people coming in through the roads. These strict border measures are necessary, and they will be enforced. So if you do not need to travel, do not travel. So we expect that the crossings of those borders should lessen over the coming days, especially with New South Wales being in that now complete lockdown. Now, Dr Young will outline a new policy today that it will only be that those few who are exempt, so that means those essential workers, they will be required from Friday to have at least 1 dose of their vaccination. So Dr Young will talk about that, but we are extremely concerned about the possibility of this virus coming into Queensland. So we will take every precaution we possibly can. We've heard reports today that the Victorian lockdown could be extended, and we know that the New South Wales lockdown will be several months. So to keep Queenslanders safe, I would appreciate that every Queenslander would understand that these measures are needed. They are strict. We will be enforcing them, and we apologise for the inconvenience. We will still the health ministers are still in discussion about that Tweed River issue, but we have not heard anything back. So we have tried to accommodate the people living in that Tweed region, but I appreciate they are part of New South Wales, and it is entirely the discretion of the New South Wales government to include them in the New South Wales lockdown. So we have tried our hardest, but unfortunately, this is the situation we're in. It is going to cause some inconvenience, but this is what is necessary to make sure that we continue to keep our Queenslanders safe as possible. We don't know where the next outbreak is going to come from. We don't know where the next outbreak from hotel quarantine is going to be, or someone who comes across our border and brings it here. So we need to keep doing everything that we're doing, and I thank Queenslanders for that. Can I also just make a couple of comments about some other matters? Can I, first of all, extend our thoughts to Totai Kefu and his family. That absolutely tragic home invasion that happened last night. Our thoughts and prayers are with him and his family. I don't think anybody would want that to happen to their home and to their loved ones. And the Police Commissioner has briefed me personally on that this morning, and our hearts go out to them, as I know all Queenslanders would. No one would expect a home invasion of that violence and nature to happen in their homes. Secondly, the bus crash yesterday. Can we also express our thoughts with the families of those injured in the head-on bus crash? 35 emergency workers were on the scene. I thank every one of them for their extraordinary work in dealing with the situation, but also in terms of airlifting people to hospital. 22 people were on the minibus. They were taken to hospital. 2 are in a critical condition. We had 2 rescue helicopters, 7 paramedics, more than 20 police and 11 firefighters. So that gives you a sort of understanding of the scale of that. So this week is Queensland Road Safety Week, and can I urge Queenslanders to please take care out on the roads. We don't want to see any more situations like that unfold. I'll hand over to Dr Young, and the Deputy Premier will be addressing the quarantine issue.
Thank you, Premier. So, good morning. So, excellent news for the southeast this morning. No new cases, and it's now 10 days since we had a case infectious in the community, which is very, very reassuring. But please, for the next week till Sunday 4 p.m, could people keep on wearing their masks? Because we know that if there was a missed case out there who was, say, asymptomatic, they could have passed it on. So we just have to be a little bit cautious for that remaining 7 days with our restrictions. Now, the significant issue that we now are facing in Queensland is we can see, and we saw this right at the start, you would remember 18 months ago there was that modelling and those predictions that once there was a significant outbreak that was not under control in another state, it would steadily move out into the rest of the nation. And that's what we're seeing out of Sydney. So we saw initially it was managed and contained to Sydney, then to Greater Sydney, and now it's escaped Greater Sydney and it's out in the regions, and it's steadily coming further and further out. We've seen positive sewage as far west as Broken Hill. We've seen it go up to Ballina, Byron Bay, Lennox Heads. So we know that it will continue to creep towards our border. So it is really, really important that anyone who normally crosses the border to go into New South Wales or comes from New South Wales into Queensland really thinks hard. And I'll be speaking to the Director Generals of all the government agencies after this briefing here to talk to them about it. That they should only be crossing the border if it is absolutely essential, and services either side of the border would fall over if those people didn't cross the border. And then to put in another protection, I know it's not quite there yet because we don't have enough of our own Queenslanders vaccinated yet, but if that person absolutely has to cross the border, that services would collapse without that support, and this is Queenslanders going into the border zone in New South Wales or people in the border zone coming into Queensland, then as another protection, I'm asking that at the latest by Friday, and I hope most of them are already vaccinated, the latest by Friday they must have had at least 1 dose of vaccine, and then 3 weeks later for Pfizer, 8 weeks later for AstraZeneca have their 2nd dose. Now, most of these people would already have been vaccinated because we've been vaccinating healthcare workers, police, emergency services since February. So I suspect there won't be many, but just in case there are, I've put that deadline in by Friday that they must be vaccinated. Otherwise they cannot, although they're even essential, they can't cross the border. That's really important. Then the other thing we've been doing is we've been pushing more doses of vaccine to all of those communities along our border. So from Gold Coast extending all the way across to the South Australian border, along that border zone, some of those communities have already done a brilliant work. So some of them are at 52% of people have had at least one dose, but I want, as close to 100% of people having had at least one dose of the vaccine in that 16-year-old plus age group. So we're targeting 70%, but of course, I want everyone to have that opportunity, because the most important thing you can do for yourself, for your own health, is to be vaccinated. We've seen a few deaths in New South Wales, but only of very, very frail elderly people who've had 2 doses of vaccine. Younger people who've been vaccinated have not been dying from COVID. So vaccine is really important for the individual. And then it's important because we also believe that it's less likely, not impossible, but less likely that you'll spread the virus if you've been vaccinated. We did see that reef pilot, of course, in Cairns, who was fully vaccinated, spread it to one other person, but not to other people. So we're unlikely to see one of those super spreader events. Again, not impossible. Nothing's impossible, but it's less likely. So that's why I'm asking that anyone who really needs to cross that border, that they're vaccinated, preferably fully, but at least the first dose. That's very important. Thank you.
Well, I'm very pleased to report that the Premier has now signed a Memorandum of Understanding with the Australian Government to allow them to proceed with the construction of their proposed Australian Government quarantine facility at Pinkenba. I want to thank officials of Queensland Government agencies and the Australian Government for working so closely together. They really have worked around the clock to get to this point and were informed by a very detailed feasibility study by consultants ACOM. This will allow for a 1,000-bed quarantine facility to be constructed by the Commonwealth at that defence site at Pinkenba, Damascus Barracks. And with this agreement now in place and the understanding that once constructed, the Queensland Government will operate the facility, the Australian Government can now get on with the job of building it. We need it as soon as possible. It's never been more urgent to have facilities like this one. At this stage, we anticipate it being ready by around the middle of next year, and we continue to urge the Commonwealth to work with us on additional quarantine facilities, including in regional areas that might be able to take pressure off our hotel quarantine system.
Well, Queensland is now the only state on the mainland east coast of Australia that is open. For us to keep it this way, we need to do everything possible to keep the virus out, and we need to do everything possible to prepare for the next outbreak. So getting tested, any symptoms whatsoever, please come forward and isolate until you get your results. And of course, vaccinations, and big shout out to every health worker, everyone who's working in the Queensland Health Vaccination Centres, including the Brisbane Convention and Exhibition Centre, that did over 6,000 over the weekend. And of course, to all of our GPs and our community pharmacies as well, who are all working together to get Queenslanders vaccinated. Last week, we were able to do over 92,423 vaccines for the week, and we welcomed the announcement yesterday of extra vaccines coming into Queensland. We believe that extra vaccine that the Prime Minister announced of Pfizer will arrive later this week, and what we will do is look at prioritising those additional vaccines to the outer ring of Brisbane. So we've seen some of our lower take-up rates in those areas, such as Caboolture and Logan. We want to make sure that we're getting vaccines out there and we're encouraging people to come forward. Of course, anyone who is 60 plus, we're encouraging you to book with a GP or community pharmacy and get your vaccine. If you're due for your second AstraZeneca, please get in and get that second vaccination done as well. If we keep doing this, if we keep getting tested and we get vaccinated as quickly as possible, we can ensure that we can work together and keep the community safe. And as the Chief Health Officer and the Premier has said, we will be requiring people who are essential workers who are being allowed to travel across that border zone to be vaccinated from Friday. So to do that, we will be putting in place measures at our vaccination centres down on the border on the Gold Coast to ensure that those who have an exemption can turn up and show that they are one of those exempt essential workers and be able to be prioritised for a vaccine. We want to support them in getting vaccinated as quickly as possible, but we do need them to do this because we need to keep ramping up our measures to make us as safe as possible due to the escalating risks we are now seeing coming out of New South Wales and, of course, now ACT and Victoria.
If I could start with our road borders, in the last 24 hours till 5 a.m. this morning, we intercepted 6,442 vehicles and we turned around 606 vehicles, which is a significant increase in the numbers of vehicles that we've had to turn around. What was pleasing, we didn't have to take any enforcement action against anyone, so that is a good thing. Although, as you've heard from the Premier this morning, there are delays. You can expect those delays to change from time to time. They can be worse and sometimes they can be better. And there has been some anecdotal reporting of people being frustrated and taking those frustrations out on police officers that are working at the border. Can I say to those persons, please be patient. It is no point getting frustrated. It will make no difference to whether you get access into this state or not. What makes a difference is whether you have the appropriate exemption to get in across the border. So people coming into this state really need to understand what those exemptions are, whether they are an essential worker and whether they can enter, because they will not otherwise. We are checking everyone. Similarly, we are still checking everyone at our both our international and domestic airports, and we put 192 persons coming on domestic flights into quarantine yesterday. We handed out 99 masks, so there are still people in our community that are not carrying and wearing their masks, so the message is consistent. Please do so. That is one of our primary defences at the moment. And we had to issue on-the-spot fines to 2 people, one in Cairns and one here in Brisbane. There were only 2 other enforcement actions taken, and that was in relation to persons in hotel quarantine not wearing masks when they were required to when answering their doors after being warned. And one arrest in Logan where a person, again, refusing to wear a mask, and not only refusing to put on a mask once given the opportunity, refused to provide details, leaving the police no options but to take action. Thank you to our businesses, so 64 inspected yesterday and all compliant. Thank you.
Happy to take some questions.
Premier, will that vaccine requirement to enter Queensland remain for the foreseeable future? Is that now a permanent rule?
Well, the Chief Health Officer will write a directive to that effect. And I think whilst we see that outbreak in New South Wales, until that is well and truly contained, it will be there for the foreseeable future.
Queensland has the policy to mandate vaccines for those essential workers. Do you think businesses should also be able to mandate the vaccine?
The requirement at the moment is for people to stay at home in New South Wales, and they should be following those directives that have been issued by the New South Wales government.
Do you think Queensland businesses should also have the power to make the vaccine mandatory for workers?
That's a matter for them. We're not getting involved in that.
Are you worried that the pink of the side has become a white elephant? It's not complete until around the middle of next year?
Well, we've made we've signed the documentation, so it's now over to the federal government. They said that they would build it, and once they have completed it, we will operate it.
And did you seek to make any changes to that MOU at all?
I tasked the Deputy Premier with that, so I think it was quite well negotiated between the 2 agencies.
Will the Pinkenba side actually take any pressure off hotel quarantine?
Yes, we hope it does, absolutely. But we also maintain that we think that an additional regional facility would also be of great assistance as well.
So it won't be used to increase caps of people coming in, it'll actually take people out of hotel quarantine, so we'll have less people quarantining.
If we have 2 facilities, then we would not have to use hotel quarantine.
With the one that we have now, the Pinkenba site, will there be less people?
Should be
in
reducing the
hotel
pressure,
quarantine?
yes.
In terms of the New South Wales Premier getting back to you about moving the Tweed border, is time running out for that to happen? Because I assume you're saying that the serious testing
I tasked that to the Health Minister. So the Health Minister was in talks with her counterpart down in New South Wales, Brad Hazzard, and we're yet to hear back. Look, I understand they are extremely busy down there. You know, I don't for one moment think how busy they are dealing with the current outbreak. And as I said yesterday, and I'll say it again, we hope that they get on top of this for the sake of the people in New South Wales and for the sake of the nation, because you've got the largest economy
If you
shut
start
down.
seeing sewage results for COVID in the Tweed area, does that option go out the door?
I'd say so, yes.
Premier, when Queensland hits 80% vaccination, whenever that is, do you intend at that point to continue pursuing a no COVID policy, as in trying to eliminate the virus, or at that point do you intend to let the virus run?
These are decisions that are being talked about at National Cabinet. We are provided constantly with advice from the Doherty Institute, and what the Doherty Institute is saying is that 80% national threshold is what we are aiming towards. So we haven't reached that yet. So I'm grateful we've got these extra vaccines, but of course we need more. Well, I agree with the National Cabinet. I agree with the National Cabinet.
No, but do you have a view on this concept of either allowing the virus to run at 80% or continuing a no COVID policy?
We don't have vaccination rates at 80% yet.
No, but when they do get to 80%.
I agree with the National Cabinet decision.
McGowan seems to be more aligned with an elimination strategy.
That's a matter for him. I agree with the National Cabinet decision about the Doherty research. We have to go on the best health modelling that is being presented to us. But at the moment, we are nowhere near that. We have 42.77% of eligible Queenslanders that have one dose, and 24.56% of Queenslanders that are fully vaccinated with two doses. Now, what we need to see, we've got that extra 136,890 coming in, but what we need to see is more supply, and we need more of our population vaccinated, because this Delta virus is real. Now, don't for one moment think that I'm not concerned about what's happening south of the border. I don't want to see that happen here. I don't want to see, if it comes here, you'll have all three major economies shut down. So we need to do everything we possibly can. And if the Chief Health Officer is recommending that those essential workers have at least one dose of vaccine, I'm all for it. I back her 100%.
So fair to say, though, you haven't yet arrived at a decision on your own thinking around that 80% threshold?
Well, National Cabinet's aiming for that 80%.
What if you disagree with National Cabinet?
No, I agree with National Cabinet. That's what we're aiming for. That's what we're aiming for.
But it's not really a question of aiming for 80%. It's do you let the virus run, or do you continue?
We're not at that position. Can everyone just I understand what you're trying to get at, but we need to make sure that we get our population vaccinated. Okay? The last thing we want to see at the moment is the virus running right throughout our state. We've got great news today with, you know, the 00, the double donut day, fantastic news for everyone. But I can't predict the future. So I can just urge Queenslanders to go and get vaccinated. And it is absolutely important that if anyone has any symptoms, to go and get tested, because it is vital, like Dr. Young says, to find that first one in that cluster so we can stamp on it pretty quickly.
If you look at the UK model, I guess that gives you some indication of what they've achieved and where they're at in the long term.
We're going to be nowhere near this 80% until November, December. This is a long way off. So unless we have the supply, well, we're in August.
No, I know, but to start thinking and forward planning for that, I mean, it's only a few months
That's what
away.
National Cabinet's talking about. That's why we're getting the Doherty research. You have to ask the federal government that. They've commissioned the research that comes into National Cabinet.
Just to summarise your thinking, you still haven't sort of made up your mind on whether we can continue containment as a state policy, or whether you let the virus run at 80%.
Well, we're not at that stage.
No, I know we're not at that stage, but we're saying that
Let's get people vaccinated.
But you haven't yet made up your mind.
I am in agreement with taking on the health advice which AHPPC has been providing and the Doherty research has been providing to National Cabinet, and we are meeting every week.
When do you expect you will make up your mind, though, on that matter? Is it when we hit the 80% threshold?
Well, we've all agreed at National Cabinet about reaching that 80% threshold, which will allow more easing of restrictions.
With Pekinbar, 1,000 beds,
Yes.
will there be a capacity to increase that? Is that the long-term goal to make it?
That's a matter for the federal government, yeah.
And the regional hub that you're talking about, is there anywhere
Well,
that you are?
Wellcamp, that's the one that we've been, yeah. I might just let the DP, yep. Thank you. Thanks, everyone.
There's been a dispute of sorts between the Guardian and Tribune newspaper in the Office of the Independent Assessor. Can you explain what's gone on there? I think you may have had some involvement as well in
Look, the Office of the Independent Assessor was created as a result of recommendations from the Solomon Review. The I in OIA stands for independent, and so I don't have any statutory function over their investigations. So questions about their investigations would need to be directed to them.
Do you think, though, that the OIA should have, I guess, the power to issue fines to journalists who don't hand over notes and recordings, and will the government consider law changes in respect to that?
So again, I'm not going to comment on the specifics of that investigation, but what I will say is that this government's bona fides in terms of protecting journalists and their sources are well demonstrated. There is a process underway right now where we are consulting with stakeholders on what shield laws should look like, and if people have a view that statutory investigators like the OIA should be included in those reforms, then they should put that forward through the Department of Justice and Attorney General.
We've heard reports of some churches in suburban Brisbane running these underground playgroups for children and mothers. What are the rules around that?
The rules are the same for everybody in terms of what our current restrictions are. So, Lydia, I'm not aware of that. Certainly we'll look into that if there are any issues with that. Our approach has always been an educative one anyway, so if we can get the details of that and reach out to these people and find out what they're trying to do and whether they can get it right in terms of how they should do it within the current restrictions.
How do essential workers who are allowed to cross prove they've had at least one vaccine at the border?
Look, that's something we'll have to work through with the health department, so it's only initial discussions around that, and obviously we have to operationalise the Chief Health Officer's directions. We've done pretty well so far, so what we'll do is look at something that is both effective and convenient for everybody so that we could make sure that that direction is obeyed once it comes in.
Would it be like showing their Medicare app?
Whatever works, I think, so that's something we'll just have to work through.
Deputy Commissioner, we got reports of a man, a tradie, who was allowed to access the Novotel Hotel this morning on level 3, signed in, checked in via the loading dock. There was only an ADF officer there to meet and greet him. He reckons he didn't realise it was a quarantine hotel, actually made it up onto level 3 where other quarantining residents are being kept, and had to take the emergency exit to get out. He's now in home quarantine awaiting a negative result. Is that possible that something like that could
Look,
happen?
I'm not aware of that specific instance. Obviously it's happened this morning, so we'll look into that. Look, anytime we have any breaches of our hotel quarantine system, whether it's by someone that's supposed to be remaining in hotel quarantine or a practice issue with people that are coming to the hotel, we review those. That's been our methodology all the way through. So if that incident's has occurred this morning, we'll have a very close look at what's happened there.
He contacted us concerned that this is how, the Delta variant gets out in mistakes like this, if that's what this was. Is that a concern of yours?
Oh, absolutely. Like, we want to make sure that our system is as tight as it possibly can be. So I'll be looking very closely at what's happening and make sure that we get it right.
One question on that. Does it sound likely that he wouldn't have been told that it was a quarantine hotel? He doesn't say that there was any police officer there, given it was a
look, I can't comment on that. There are systems that are in place to make sure that that happens. And if it happens the way it should, no, that shouldn't have happened. But if something's gone wrong, we need to look at that.
Do you have any details about the frustration that was shown to police this morning?
Look, I know there's been some reporting around people yelling and that like, and we've seen that every time we've done this. Every time we change the border directions, right back to the beginning, we've seen delays, we've seen concerns out it until people understand what's required of them. I'm absolutely confident that as the week goes on, we'll see things start to settle down a bit. The important thing for everyone that's coming across that border is what we're trying to achieve here is don't move unless you absolutely have to, because that's what we're trying to do to prevent the virus spreading. Thank you.
Very good question. Thursday, Friday night, we saw a lot of delays with ambulances again, and rostering showed across Brisbane there was around 30 officers down each night, and also up to 15 000 calls were left on hold at one point. I know we've heard a lot about the government's investment with 100 million and extra staff being hired. How long will it be, do you think, that we keep experiencing these sorts of delays?
Oh, well, look, what we know is nationally, every single jurisdiction is facing extreme demand that we've never seen before. So we know we have surges throughout the year. We know that demand is growing year on year across our health systems across the country. But with COVID, we are seeing this added level of demand that is putting pressure on the whole system. So we're absolutely committed and working really hard with the Queensland Ambulance Service and all of our hospital and health services to roll out those extra beds. So that's our priority right now, because by creating extra bed capacity, we get people out of emergency department, which means we get people out of those ambulances quicker. So as far as rostering, that's operational issues with QAS that they manage, and they manage well every day. But there is a lot of demand out there at the moment, and I remind people that you be patient and also respectful to our staff. Those in our call centres working in our hubs around the state with ambulance service do an incredible job. It's a difficult job, and I know they're doing their best.
It's not just demand, though, is it? Because there's 30 officers down at night. That's going to have an impact. And
we're putting, I commented about this, and the ambulance commissioner said this at estimates. They're actually putting on extra shifts at night time. In fact, it was the opposition who was criticising us for putting extra staff on to solely do those night shifts to supplement the workforce. So we're actually targeting that particular area, knowing we need extra shifts on, and that's what we're putting money and extra staff to. So I think it's more a question of why the opposition would be criticising that.
So in that sense, you say that you are putting more rosters and more staff, more everything. How long will it be, do you think, before that has an impact and we see a drop off in this 3, 4 hour, 5 hour, 6 hour wait for ambulances?
Look, I've seen some improvements in numbers, but any given day there's going to be demand in certain areas that you have to work with. So it's not consistent across every part of the state, every minute of the day, and we have to look at those fluctuations. But I have seen some promising numbers. We are starting to see some improvements in the lost time and patient off stretcher time, but we of course want to see that come down a lot more. That's why we've put extra money into bed capacities, and also we're putting on extra paramedics.
What is the trigger for us to renege on our offer to move the border with it creeping slowly north?
Well, I think the Premier just said if we start seeing positive sewage and positive cases in Tweed, then we're going to have an issue with having that free access back and forth. But we're in discussions at the moment. As the Premier said, New South Wales are under extreme pressure at the moment trying to manage outbreaks right across the state. We know the Tweed area is a really important area that we'd love to see people be able to move back and forth in a safer way and a more efficient way, but we've got to do it in a way that is safe to everyone.
What's the data telling you? How many people actually do go across the border there?
Oh, look, I don't have the figures in front of me. I'm happy to. There's quite a few people, as I understand, who live in the Tweed who come across the border for work every day, and there's quite a few who live in Queensland who go and work in the Tweed. So we know that's a big population area that moves back and forth a lot, and I'll continue to talk with the Health Minister. I know he's talking with the Premier about this issue.
Basically, time's running out to move the border.
Oh, look, the offer's there, and we're happy to work through. There's a number of operational issues to work through, but an hour is a long time when you're dealing with COVID, as is a day.
Dr. Can I just ask you on this border process for vaccination?
Last one, thanks.
That was my question too. Thank you. The card. Is the card enough, or for people to clarify?
Look, I trust people. So who's going to go and put forward and say they've been vaccinated when they haven't been? Of course we'll have audit and we'll work that through with police and we'll do that. But if someone says, I've got it myself, I've got it on my iPhone, I've also downloaded the certificate and that's in my handbag so that I can show. And I've had last year, for those of you who went to any aged care facilities, you had to provide proof. I did that last year. I went to a number of aged care facilities and showed I'd been vaccinated against flu. This year, you'll have to show you've been vaccinated against flu and against COVID. So it's an easy process.
What do people do if they, I mean, I'm sure it's a small amount, but people who can't have the vaccine for whatever reason, allergies?
It's tiny. It's tiny. And if you cannot have the vaccine for your own sake, you have to stay home, because while there's an active outbreak going on, you're putting yourself at enormous risk. So remember that the number who can't have the vaccine is so small, and it's because they've got significant other issues. So for their own sake, they just need to stay home and use friends or neighbours or relatives to help them with food and essentials.
Got to get to Cabinet. Thank you.
Thank you.